This is a community, first and foremost. They survived and they're resilient because these things have happened before. It may not have been a pandemic, but they've experienced things before that kind of made them ready and prepared for this.
America has suffered upwards of 220,000 deaths due to COVID-19, more than 23,000 of them in New York City. In Brownsville, Brooklyn, more than 2,200 cases have been reported, and many of those people have sought treatment at Brookdale University Hospital and Medical Center. Brookdale, like the neighborhood around it, has been fighting the pandemic on two fronts: the disease itself and the emotional and psychological damage from the loss of loved ones, the loss of work and wages, and the loss of freedom to just live life normally. But a lot of this stress goes way back.
Intergenerational trauma, where the parents had trauma themselves, the grandparents had trauma, and we're really in the first generation where people are getting a reasonable amount of mental health supports.
Dr. Camille Archer, a child and adolescent psychologist at Brookdale, says a lot of people may not realize that during the height of the pandemic, many of her young patients were waiting at home, uneasy.
This community, I think, has a high percentage of essential workers. And one of the things that I saw a lot with the children here is that they would worry that their parents have to go out to work. And that caused a lot of anxiety and, their fear that their parents are going to get it, that their parents are going to get sick and bring it home to them.
Other reactions to the pandemic varied, depending on how old her patients were.
A lot of conflicts with adolescents and their parents were about, they want to hang out with their friends, they're leaving the house, they can't stay here, this is horrible. But then there's a real subset of children who are anxious, who are being teased or bullied in school, and those kids are so happy they don't have to go to school.
In the spring, Dr. Archer was treating most of her patients remotely. At the same time, Brookdale's emergency room was under intense pressure, according to its chair of emergency medicine, Dr. Sandra Scott.
No one really expected what we experienced. So once it became evident that COVID-19 was on its way to New York City and on its way to America, we started to prepare in the best way that we knew how. So we started to think about surge space. We started to think about what additional equipment we would need. So for example, the oxygen demand went up considerably. So we went from an emergency department that maybe had an exchange of 10 oxygen tanks per day to an emergency department that needed 250 oxygen tanks per day.
But it was far more than a question of beds and equipment. Dr. Scott agrees with people who say this was akin to going to war.
So I feel like my employees were soldiers in a war against this pandemic, and they showed up. And they supported each other. And that's what kept people coming to work every day. That's what kept me coming to work every day. Even though we saw unbelievable, unimaginable tragedy on a daily basis, the drive to provide care and to help and to try and save as many lives as possible is what got people up in the morning and helped them to perform the selfless act of taking care of others.
I'm wondering how many of those folks were presenting with pre-existing conditions that sort of exacerbated the condition that they were in with relation to COVID, and how that may have made things more difficult for a place that serves a community like Brownsville.
I think what this pandemic has done is it's a big, gigantic spotlight. So for some of us, we already knew intimately what we were dealing with, and we weren't terribly surprised that the pandemic had a much more a negative impact on this population. I think the culmination of the Black Lives Matter movement and the pandemic highlights how the outcomes that we see are really outcomes of racism and slavery.
There's a direct line from centuries of barriers for Black and brown people to the deep healthcare discrepancies Dr. Scott sees in Brownsville today. the neighborhood with the lowest life expectancy in all of New York City. But she also sees some specific, affordable solutions that should be nurtured.
We learned that telehealth was super, super effective. And, we have the technology to provide telehealth to all kinds of communities, right? You don't need to be in a wealthy community to see your doctor on your smartphone. We should have been doing that a while ago, right? We should have had that access to telehealth for all communities should have been readily available, and it should be readily available today, because that's a very effective, reasonable, relatively low tech in this day and time way to bring healthcare into the household of people who are not able to get out of their household easily to access healthcare.
And even if you can get to the ER, no one wants to sit around with a deadly virus in the air.
We opened a new process in our emergency department so that patients can actually call ahead and speak to a nurse, and the nurse can give them guidance about checking into their visit from home so that they really are, having their weight at home. But let's say that you weren't able to get your diabetes medicine refilled, you can't get in touch with your doctor, you have one more day of medication left, you're feeling reasonably well. That's a situation where you can say, hey, I feel like I need to come in. And we can say, all right, come in, we're ready for you at 10 o'clock. And you leave your home, you come in, and we see you right away and we get you right out.
Meanwhile, Dr. Archer says the healthcare system hasn't done enough to treat the psychological impact of COVID.
No, I'm not satisfied at all. I don't think there is much mention of mental health in terms of this pandemic. And there are a lot of mental health issues that have been exacerbated or unroofed because of the pandemic. For example, there are a lot of people who have become more isolated, and now it's gotten worse because they're so isolated, because they're not around their family, they're not around a lot of people.
Dwight is an outpatient at Brookdale, diagnosed with schizophrenia. He lives with his father and doesn't work outside the home. For him, the pandemic has meant long stretches of cabin fever.
The cabin fever in my house is more walking around the house trying to find things to do. And when everything is done, as you see, to the refrigerator, on the couch, to the refrigerator, on the couch, and then you might lie down and take a little sleep or something like that. Then you wake up and you say to yourself, I can't live like that.
Dwight started hearing voices at around 20 and says he and his father used to be at war. But since he's had consistent treatment, things are much easier between them.
You and your dad worked it out now. You guys got to a good place, the war is over. But if you had to describe what schizophrenia is to someone who has no idea, what would you tell them?
Schizophrenia is an illness where you hear voices and voices telling you to do things. Your feelings does be up and down most of the time. You have sad days and you have happy days, But most of the time you're sad because I thought that I was dealing with something mystical, and some mystical being or something did something to me, and now I'm walking around with a bag of noise in my head and people talking to me.
Do you think it's harder for someone who might have schizophrenia or another mental health issue to deal with this pandemic and what's happening now?
Yeah. With mental illness, it could be harder on them because, as I say, they blame themselves for everything. If the corona don't have nothing to deal with them, it's just a disease which they find in China, and they seem to get a crazy mind off it, and it's hard on them, you know what I mean?
Having learned in his mother's kitchen, Dwight's a good cook. His speciality is roti. But the metaphor he uses to describe his condition is more beverage related.
Yeah, like everybody is drinking hot chocolate and I'm drinking tea. It's because after the schizophrenia, it's like everybody is in a different world, But I gotta face the reality that I'm a tea drinker, I'm different, you know what I mean?
Facing reality, something places like Brownsville have had a lot of practice with. something the whole country could stand to do as 2020 leads us into its final uncertain months.
We have to acknowledge that another wave of something is coming. So I think that's the first thing, is to be realistic and to say, listen, we have a problem. So it needs to be you and me and others, not necessarily Black and brown people having this conversation, not necessarily women having these conversations, right? It needs to be multi-generational, multidisciplinary, multicultural, multi-ethnicity, having the conversation and then collectively creating the solutions.